Tips for good liver health for diabetics. Tips for good liver health for diabetics will help patients have a way to improve their health better in the early stages of liver disease and bring more diabetes. Type 2 diabetes is a chronic condition that affects how your body metabolizes sugar. It happens when your body becomes resistant to insulin. This can lead to complications, including liver disease. In many cases, liver disease causes no noticeable symptoms until it's very advanced. So, it can make it harder to detect and get early treatment for liver disease. Fortunately, there are steps you can take to lower your risk of liver disease with type 2 diabetes. Liver disease in type 2 diabetes, and how to reduce your risk. Types of liver disease affect people with type 2 diabetes. An estimated 30.3 million people in the United States have diabetes. Most of those people have type 2 diabetes. Meanwhile, people with type 2 diabetes are at risk of several liver-related conditions, including non-alcoholic fatty liver disease, NAFLD, severe liver scarring, liver cancer, and liver failure. Of these, non-alcoholic fatty liver disease is particularly common in people with type 2 diabetes. Non-alcoholic fatty liver disease, NAFLD. Non-alcoholic fatty liver disease is a condition in which excess fat builds up in your liver. Typically, fat around the liver is associated with heavy drinking. But in non-alcoholic fatty liver disease, the accumulation of fat isn't caused by alcohol consumption. It's possible to develop non-alcoholic fatty liver disease with type 2 diabetes, even if you rarely drink alcohol. According to a 2019 study, about 50 to 70% of people with diabetes have non-alcoholic fatty liver disease. Meanwhile, only 25% of the general population has it. Moreover, non-alcoholic fatty liver disease severity also tends to be worsened by the presence of diabetes. Scientists believe a metabolic breakdown in the body, such as that seen in type 2 diabetes, greater than leads to fatty acids being released into the bloodstream, eventually accumulating in a ready receptor, the liver. Non-alcoholic fatty liver disease itself usually causes no symptoms. But it can raise the risk of other conditions such as liver inflammation or cirrhosis. Cirrhosis develops when liver damage causes scar tissue to replace healthy tissue, making it harder for the liver to work properly. Non-alcoholic fatty liver disease is also associated with increased risk of liver cancer. Tips for good liver health for diabetics. When you're living with type 2 diabetes, there are several steps you can take to protect your liver. All of these measures are part of a healthy lifestyle. They may help lower your risk of some other complications from type 2 diabetes too. Maintain a healthy weight. Tips for good liver health. Many people with type 2 diabetes are overweight or have obesity. That can be a contributing factor to NAFLD. It also raises the risk of liver cancer. Weight loss can play an important part in helping to reduce liver fat and the risk of liver disease. Consult with your doctor on healthy ways to lose weight. Manage your blood sugar. Tips for good liver health. Working with your doctor to monitor and manage your blood sugar is another line of defense against non-alcoholic fatty liver disease. To manage your blood sugar, it may help to eat at regular intervals. Incorporate foods that are rich in fiber and healthy carbohydrates into your diet. Only eat until you're full. Get regular exercise. It's also important to take any medications that your doctor prescribes to manage your blood sugar. Moreover, your doctor will also let you know how often your blood sugar should be tested. Eat a well-balanced diet. Tips for good liver health. To help manage type 2 diabetes and lower your risk of liver disease and other complications, your doctor may advise you to make changes in your diet. For example, they may encourage you to limit foods that are high in fat, sugar, and salt. It's also important to eat a wide variety of nutrient and fiber-rich foods, such as fruits, vegetables, and whole grains. Exercise regularly. Consistent exercise helps to burn triglycerides for fuel, which can also reduce liver fat. Try to get at least 30 minutes of moderate-intensity aerobic exercise, 5 days per week. Reduce high blood pressure. Tips for good liver health. Exercising regularly and eating a healthy diet can help prevent and lower high blood pressure. People can also reduce high blood pressure by reducing sodium in their diet, quitting smoking, cutting back on caffeine, limit alcohol intake, tips for good liver health. Drinking in excess can create many health problems. When it comes to the liver in particular, alcohol can damage or destroy liver cells. So, drinking in moderation or abstaining from alcohol prevents this. 7 days to drink less online alcohol reduction program. Link in the description. When to see a doctor. In many cases, non-alcoholic fatty liver disease causes no symptoms. That's why it can come as a surprise to people when they're diagnosed with liver disease. Also, if you're living with type 2 diabetes, it's important to check in with your doctor on a regular basis. They can screen you for potential complications, including liver disease. For example, they may order liver enzyme tests or ultrasound exams. Non-alcoholic fatty liver disease and other types of liver disease are often diagnosed after routine blood tests or ultrasound exams show signs of a problem, such as high liver enzymes or scarring. In particular, you should also let your doctor know if you develop any of the following symptoms: yellowish skin and eyes, known as jaundice, pain and swelling in your abdomen, swelling in your legs and ankles, dark-colored urine, blood in your stool, pale or tar-colored stool, skin itching, chronic fatigue, nausea or vomiting, reduced appetite, increased bruising. Advice. One of the potential complications of type 2 diabetes is liver disease, including non-alcoholic fatty liver disease. Checking in regularly with your doctor and maintaining a healthy lifestyle. That is essential steps you can take to protect your liver and manage your risk of complications from type 2 diabetes. Liver disease doesn't always cause noticeable symptoms, but it can cause serious damage. That's why it's so important to attend regular checkups with your doctor and follow their recommendations for liver screening tests. Note: understand the causes and prevention of liver disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: The Free Solution for Fatty Liver. Or visit 247naturalhealth.com to all chronic illness information. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.